Tonight we have with us Dr. Gregory Mabry. Dr. Mabry currently serves as the U.S. Army's Training and Doctrine Command Behavioral Health Capability Manager for Army Health Systems, a guest lecturer for grief and bereavement at the Joint Base San Antonio Fort Sam Houston Casualty Assistance Center, an adjunct professor at Purdue University's Graduate Psychology Program, and Chief Medical Advisor for BioCrypt Technologies. He holds an Associate of Science in Nursing from Baptist School of Health Professions, a Bachelor of Science in Nursing from American Sentinel University, a Bachelor of Science in Sociology from Austin Peay State University, a Master of Arts in Information Technology Management from Western University, a Master of Social Work from Fayetteville State University, and a Doctorate of Psychology and Clinical Psychology from California Southern University. He will complete his Master's of Science in Nursing with a concentration of Psychiatric Mental Health Nurse Practitioner from Northern Kentucky University in summer of 2021. Dr. Mabry earned 2 congressional nominations to the U.S. Army Astronaut Candidate Program in 2016 and 2020. Dr. Mabry's key assignments include Deputy Chief Behavioral Health for the 101st Airborne Division, Air Assault, Aviation Behavioral Science Officer for Combined Joint Task Force Thunder, Operation Enduring Freedom, and Behavioral Health Science Officer for the 159th Combat Aviation Regiment. He is also the U.S. Army's Behavioral Health Representative to the North Atlantic Treaty Organization's Global Medical Task Force. Dr. Mabry will be speaking to us tonight on the timely topic that many of us are facing currently of how to cope with morbidity and mortality associated with COVID-19. So without further ado, Dr. Mabry, I'm going to turn the stage over to you.
Thank you, Michelle. So hello, everybody. My name is Dr. Gregory Mabry. So after hearing all that, basically it means that I know stuff and I do stuff. But one of the things that I do is I assist the Army Medical Department with coping with anything that even smells like behavioral health, such as anxiety, depression, and insomnia. And with this whole COVID-19 business going on worldwide, we're adjusting to a new normal. And that new normal isn't something that we are well used to, and things that we haven't grown up with in our childhood and even adulthood. So with that being said, we have some challenges as a society and as a medical profession to deal with and to figure out how we can take care of ourselves while taking care of our patients and assisting those around us with this new normal. So with that being said, let's get on with our presentation. So things that I deal with, especially in the military, I have military healthcare providers ranging from dietitians to nurses who care for a population ranging from your typical soldier to your elderly in our retiree population. So the things that I'll talk about in this presentation, these are my positions alone, and they do not represent the U.S. military. That's that standard disclaimer. And the things I talk about, especially any products that I talk about in this presentation, I'm not getting any type of financial endorsement from this presentation, any of the products that I endorse. So here are the outcomes of the presentation. We want to give you a understanding or a general understanding of some of the concepts that healthcare workers are encountering, especially with COVID-19. Mortality and or morbidities, you're going to see a lot of general medical issues that are further exacerbated by COVID-19 and how it affects you personally on seeing the unprecedented amount of death in this particular occupation now ensue. Next, you have, I'm going to give you some resources that are going to be available to healthcare workers to help cope with the stress of COVID-19. Stress not just in a clinical nature, but this new normal of telecommuting, working from home. How do you make your home environment your office environment? How do you separate the two? And then lastly, I'm going to give you some free resources. Oh yes, free. Anything where you don't have to pay money to get good clinical resources and good help. That's definitely a key aspect of utilizing the COVID-19 resources we have here. So here's our agenda. So why is this so hard? That's the million-dollar question. Why is it so hard to adjust to the new normal? Well, we're social animals. We're social beings. We are used to being around people, hugging, kissing, touching, holding hands, shaking hands. These are things that are built into, well, society. And over time, we as humans have adapted to the social aspect, the social hierarchy, the social construct of physical touch, being close to somebody without feeling like you're in mortal danger. When you hug somebody, a chemical is released, oxytocin. Well, there was an article that was released in the New York Times that shows that we are oxytocin deficient because we are not getting our typical, well, hugs, typical touch. And when this happens, some physiological, neurological, and even psychological and cognitive changes happen. The first thing that happens is, well, we get depressed. We go through CNS, central nervous system depression. So our heart rate might lower, our breathing might lower. We don't feel like engaging, whether it's our coworkers or our family, because we're not feeling like ourselves. So when this happens, we didn't really understand what was happening initially. So this is something that we call a moral injury. A moral injury is akin to something we've seen before in our lifetime, not just from a military aspect, but from a societal, a macro societal aspect. Back when 9/11 hit, it was a change in how we perceived the world. It was a paradigm shift. The world was no longer safe. Everything was a threat. Everything could be linked to terroristic activity. That's the world we live in now. And we live in this world for roughly 20 years. And we've adapted to this. It used to be you can get through airport security extremely fast. Now you have to plan ahead because security measures are tightened. Well, the same thing is happening now, or the same phenomenon is happening with COVID-19. We are actually experiencing adult stranger danger. Adult stranger danger. You think back to when you're little. We're teaching your kids, hey, you can't go up to random strangers. Stranger danger. They could be dangerous. Well, that danger is back, but it's back at the adult level. And if someone came to my clinic and said, hey, Dr. Mabry, I don't want to go outside. Everybody I see is a threat. I don't want to get near anybody. I don't want to shake their hand. When I'm walking through the grocery store, or someone gets too close to me, I cower in fear. I'd be ready to take them back to my office and diagnose them and treat them for some type of social anxiety disorder. But if you fast forward to 2020, I mean that's 2020. That is the new norm. So how do we cope with this new norm? How are we going to transcend this new normal to get away from the anxiety, the depression, the insomnia that we experience with this stranger danger? So looking at the systematic review of mental health and COVID-19, a lot of the symptoms that you see from not wanting to be around people, the general avoidance, that is the same symptoms we see in post-traumatic stress disorder, PTSD. And with PTSD, there's a high prevalence of the anxiety, the depression, the insomnia, and we call it post-traumatic stress. Not only are you feeling these things as a normal member of society and as a healthcare worker, but your patients are also going to be experiencing these things as well. And when we had patients who already have some type of mental disorder or even some type of physical ailment, we realize that psychiatric disorders or the symptoms of these disorders actually worsened with the COVID-19 pandemic. It was almost as if all their worst fears came true. Well, along the healthcare workers, we're seeing more prevalence of the depression to the point to where we're talking about, suicidal ideations, depressive symptoms, and sleep quality. And sleep quality is kind of the domino that once that domino falls, it's hard to recover. The rationale for that is, well, sleep controls a lot of things. It controls your ability to heal physically. It controls your ability to maintain your mental health, because if you don't sleep, you get a little irritable. If you get a little irritable, it affects how you interact with your patients, your coworkers, your family, and this definitely will not suit you in your current profession. So what we need to do, we need to see how we can mitigate the effects of the COVID-19, the staycation, if you will, or the staying away from people. How do we mimic the get wellness of the mental health capacity without actually seeking that mental health treatment? And this is what we're going to talk about. So one of the things that we talk about is exercise, right? If you get, exercise, you have these biochemicals called endorphins. The endorphins kick in, and that brings up your happiness level. If you're not happy, then that leads to depression. And if you're not sleeping, that leads to depression. And if you're not getting your daily levels of oxytocin from physical contact, that leads to depression. So it's kind of like that trifecta. If you're not getting the things you need, it leads to depression. Well, with the exercise that you can do in your home, that raises your levels of endorphins, and it actually allows you to get higher levels of that happiness drug that occurs naturally in your body. So when we say exercise, we don't just mean, I'm going to walk to the refrigerator and back, or I'm going to lift this remote and back. No, we want you to get at least 30 minutes of cardio. Now, cardio is relative. If you are an avid runner, go ahead and run. If you're not an avid runner, don't start running, but you can go ahead and do your 30 minutes, around the block. If you have a treadmill, use that treadmill while you're working, while you're watching TV, and you can make it a family activity. Exercise doesn't have to be a chore. It can be something that is, very enjoyable. So I would love for people to do 1 hour a day, but I'm a realist. I'm not going to tell you to, run a marathon, first try. Definitely not. If you can start off with 30 minutes a day, just, getting some type of cardio activity, that will do wonders for boosting your ability for maintaining, good sleep, achieving good sleep, and mitigating those factors that could lead to depression and insomnia. If you have a whole lot of energy, coursing through your veins at night, if you had to drink those monster energy drinks to get through the day, kind of need to burn off some of that. And getting that good exercise not only gives you good cardiovascular health, but it can also prepare you for a good night's sleep. Now, for you lovely dietitians, I know everything is centered around nutrition. I get it. I understand. But there's this lovely doctor, and anytime I see somebody who has, 2 doctorates, they mean business. So this doctor, he was required reading during my doctoral work in mental health. So nutrition and mental illness. Everything that we do, everything that we eat, we digest, we turn into some type of chemical in our body. And using the orthomolecular approach for attending to mental health, that's going to be your key for those who don't want to get out there and do lots of vigorous exercise. In addition to that, if you're not eating healthy, and if if you just kind of feel like blah, if you feel blah when you're eating a lot of fast food, greasy food, and not burning that off, then that's going to affect your mental health. And we don't want that to happen. So this is a excellent read that I have, Nutrition and Mental Illness. If you want to pick it up, it gives you lots of good tidbits from an orthomolecular approach, and it appeals to nutrition and dietetics when it comes to mental health and mental illness. So in mental health, we know that we have good education for people, but as dietitians, you can give great patient education. You can talk to the nurses, you can talk to the physicians and the PAs, and you can give them the best education on what needs to happen from your professional standpoint. But people are going to do what they want to do. And this is the first thing you have to realize, especially when it comes to mental health and nutrition and trying to cope with the new world and COVID-19. You have the ability to affect you. Now, you have others around you that may not want to adhere to certain aspects of sleep hygiene or eating better. Because if you're going to eat better, it's not just a one-person endeavor. It has to be the village. It has to be the family. If you're going to eat healthy, chances are you're going to fix healthy meals for lunch and dinner. So if you have the ability to coax your spouse, to coax your children to eating healthier, to increase their levels of oxytocin and serotonin and things that will make them happy. Because again, you can't just, it's a domino effect. If you're depressed and if you're not engaging with your family and friends, then it's going to have a domino effect, and they're going to be unhappy as well. So if you can do this together, that can go a long way to increasing your levels of good chemicals in your body that will allow for positive sleep, to mitigate the depression and anxiety symptoms. So this is where you want to assemble the team. When I say assemble the team, I mean you're going to have to talk to not just you, not just your fellow nutritious lifestyle employees, but also the nurses and the staff and the dietetic staff in the homes and in the medical treatment facilities. And the rationale for this is whenever you have a patient in the facility, especially if they are affected with COVID-19, or you're seeing lots of death, lots of illness due to complications with COVID-19, you're going to have some grief. We're going to have some grief reactions. The proper name for it is adjustment disorder grief reaction. And this adjustment disorder essentially means you're having a normal reaction to abnormal events. So if you have an assisted living center that typically has 1 or 2 deaths, maybe a month, but now you're having 1 or 2 deaths maybe a week, if not more, then that's definitely a time that it's, again, not normal, and you're adjusting to the new normal. You have to process that information. And if you're going to process that information, you need to do it as a team. Everything from having maybe a memorial with staff members to having what I would call Skype mimosa time. When I say Skype mimosa or Zoom mimosa, that means getting together with your team members. I know you guys are arranged in different areas where you may have a supervisor and you have different people within your team, and you have miniature staff meetings where you have a staff meeting. Get together on a afternoon, after the workday is done. It's a virtual get together where you can actually process some of the things that occurred that day, and not just process, not just griping, about work, or not just, talking about what happened at the assisted living facility that day, but, processing, hey, I cared for Mr. Smith for 2 years and he passed today, or I cared for, Mrs. Smith for a month and she passed today. It was unexpected. So these are things that you want to do to help process that grief, because part of that adjustment disorder grief reaction will actually inhibit your ability to sleep. If you're processing these things in your head, if you're not actually talking about it with your coworkers, when you go to sleep, you're going to close your eyes, and the subconscious has a way of working itself out. If you're not actively talking about it with your friends and your family, when you close your eyes, your brain's going to want to process it for you. And while it's processing it, it's going to lead to nightmares, tossing and turning, and not getting good quality sleep. And like we said before, if that grief reaction leads to depression, and not getting enough sleep leads to depression, then that's kind of a double whammy on depressive symptoms, and it's harder for you to get out of that funk. So moral injury is at times self-medicated by individuals who don't reach out for help. And in the healthcare profession, substances are readily available, either legally or illegally, either prescription or non-prescription. And that leads to higher instances of substance use by healthcare workers. And especially in the nursing field and the healthcare field, the nurses and you as dietitians, you're around substances all the time with prescription medication. But talking about these moral injurious issues can lead to mitigation of the substance use. And people use that to kind of numb themselves, where you're getting so much death, so much grief from these assisted living facilities that you don't want to feel anything. You don't want to feel bad or sad or angry. And the way people go about it is they numb with drugs and alcohol. And even if you don't partake in the drugs and alcohol, they partake in risky behavior. And these risky behaviors can lead to injuries or self-injurious events. And that's not something that we want to do. And prior to COVID-19 and prior to having all this death around us, if you were a smoker or partook in alcoholic beverages, typically the use will actually increase. And that's something to be aware of. And if you can have that self-awareness that, okay, maybe my drinking has increased since the death of Mr. Smith, or maybe I've gone from half a pack a day to 2 packs a day, from dealing with the stress of seeing all this death around me, then I think that's a great sign to reach out for help and talk about these things within your small circle, within your team at Nutritious Lifestyles. So people always say, oh, well, healthcare workers are on the front lines, And when you say front lines, people equivocate front lines to military. And honestly, it's true. Healthcare workers are on the front lines. They are the new, they're in the fight. And there are some examples that have parallels with healthcare workers and what they're seeing to military examples. And this further proves that, yes, not only are you in the front lines, that you're experiencing a lot of what I would call combat stress that a typical military member would experience, that you're now experiencing as a healthcare professional. And these are some of the signs. So sometimes we have trouble recognizing when we need help ourselves. But if any of these sound familiar, to you or to your family or even to your supervisors, then this is a key indicator that you might want to take a knee. We call it in the military, take a knee means taking a break, to self-assess, and then go forth, do your job well. But you need to realize if you don't take care of you, who's going to take care of others? If you can't take care of yourself, how can you take care of others? So the first example that I have from a military standpoint is people would return from deployment, and they would hear about some of the things that happened on their watch. Well, returning home, or hearing that someone's health condition worsened at work or facility that you're working in, that, oh, I was taking care of Mr. Smith for so long, and all of a sudden he took a turn for the worse. And that's a terrible feeling, especially if you're not talking about just a patient, but even your coworkers. It's not just the patients that are sick. It's the people who are in those facilities that work there that are getting sick as well, because COVID-19 is so rampant. Next, that you're being told, or you're hearing that a sick patient didn't survive, and it's not that they didn't survive because they were sick. Maybe it's because there's not availability of equipment such as ventilators, or maybe they didn't get timely treatment that you thought they deserved, or there's a shortage of clinical personnel. It's a terrible feeling to know that someone perished, not due to lack of skill or lack of training, but just there wasn't enough equipment to go around. That's a terrible feeling to have. The next one I have, as ancillary medical personnel, and I understand myself, our job is to be consultants. Our job is to give recommendations. Our job is to provide informed opinions. And then it's up for the prescribers, for the independent providers, to provide that life-saving order, or that treatment plan, that treatment order. Well, we can only recommend. And it's got to be frustrating to recommend a certain treatment and have it ignored or not executed in a timely manner. And that can be anger producing. Not necessarily feeling that you could have done more, but angry at the world, angry at the system. And that anger can translate to apathy real fast. So again, these are some moral injury examples that I want to give to you to see if you recognize this, maybe not in yourself, but maybe in others within the team. Getting tags. Obviously, the goal is to avoid getting tags. Getting tags, even though that you provided recommendations to leadership and you still get blamed. That also could be very anger-producing. You just kind of throw your hands in the air and say, well, I tried to tell an administration and they didn't listen. But you still get blamed for it. This causes moral injury, meaning that you actually did everything you're supposed to do and things still turned out badly. And that internal feeling that you have now causes that moral injury. And then last, feeling let down because you're working with insufficient resources or staffing. People see that as a slight, as administration not listening to their concerns or listening to the recommendations. And if you perceive this as avoidable, then this can cause moral injury as well. But just giving you examples of the parallels that I would treat a military member who was on the front lines of a war, of a battle. The parallels are there. And so here's some more examples, especially possible NLS examples. Maybe the clinical decisions, by others that you believe are unethical or ineffective. We all have licenses. We all have, credentials that we need to maintain. But if you perceive someone to be doing the wrong thing, against, their license, or overstepping their license, or doing things outside their lane or outside their profession, and because of this, their actions could have cause harm. That's an example of seeing someone kind of go down the wrong path, and it's up to you to provide them that guidance. Because if you see something, say something. That's what they always say. But that's something that you have to provide to that fellow coworker if you see that happening. Failing to report serious clinical incidents, near misses. There's always a near miss, but if a near miss happened because not due to you in part, but near misses that happen all the time in a facility just because they happen, but failing to report those. If you see a near miss, you may internalize that, and you go home, you don't report it, and it's weighing heavily on you. That can also cause a moral injury. And then, changing in treatment plan or protocols. If you have a protocol that is effective, and in the clinical world, if it's not broken, then don't fix it. But you may have a new administrator, or you may have a new policy that goes into effect that you perceive that could be a detriment to your patients. As a consultant, if you think that it's not good, then it's up to you to voice your opinion. But if you don't, and you kind of sit on that and you internalize that, that can also cause moral injury, because these are things that again weigh heavily on you. But unless you actually voice that opinion, that could affect your ability for restorative sleep, anxiety, and depression. And then we all had to start somewhere at some time. We didn't come out of our internships as the #1 expert in our fields. No, that doesn't happen. You have to have some type of training. You have to have some type of life experience during the course of your job. Well, we go to different facilities all the time, whether if it's a psych facility or geriatric. When you did your dietetic internship, some of them may have been in geriatric, some may have been in psych, some may have been in other places. But when you get the assignment to go to a geriatric facility or a assisted living facility, it may be something totally outside of your experience, but you have to adapt, and you will adapt over time. But if something happens due to inexperience or indecision, working outside your normal competency, you might internalize that as, oh, where did I go wrong? Did I do something wrong? And you start second-guessing yourself, and that can also lead to moral injury. So there are a lot of aspects that parallel, military, combat stress with a frontline worker, especially in the dietetic field, in the healthcare industry. So free resources. So for those of us who love to go to the websites, who love to browse, we have a lot of free resources. And I say free half-heartedly because actually a lot of these are government resources that you've already paid for through your taxes. So I thank you as a tax-paying American. But these resources have actually have been utilized by the Department of Defense, by the Veterans Affairs, and I'm going to show you some examples of the resources we have to provide you good information, self-care at home, and good self-treatment to help mitigate some of the aspects of moral injury, anxiety, depression, insomnia, and adjustment disorder, grief reaction. So I'm going to exit out of this PowerPoint and I'm going to pull up some of these websites. Okay, excellent. So this is from the National Center for PTSD through the Veterans Affairs, and this goes into more in depth about moral injury, and it talks about what needs to happen for a moral injury to occur. In addition to that, what are some of the reactions that you might see and feel? We definitely want you to get some good training. What are some of the events that could happen? Of course, we're experiencing one right now. And how similar is it to PTSD? How do you assess moral injury? And there's a questionnaire that I'm going to provide to you. That way you can take the self-assessment questionnaire, and you can probably provide this to others within your clinical departments. So when you go back to your facilities, it will happen one day, maybe not today, but one day, you can provide these in-services to the nursing staff, and they will love you for it, because nurses love training. And if you want to, go there, shaking hands, well, not shaking hands anymore, I guess bumping elbows and, being the best things to slice bread, provide in-services. They love free training. So this is how you treat moral injury, and it goes into particular aspects that you can go through for structured therapy, or even aspects of self-therapy. But specifically, we want to talk about moral injury in healthcare workers. So I'm going to pull that up for you as well. So this is a resource on how to prevent moral injury in healthcare workers, especially when you talk about COVID-19 during the pandemic. And it talks about some of the symptoms. Again, the shame, the anger, that distrust, loss of a vulnerable person, an elder or a child. How these are not normal aspects of everyday life. So learning to, one, acknowledge it, recognize the symptoms, and then seeking that treatment, seeking that self-treatment, self-care tips. And provides several links for not just you. And again, they're the symptoms. Again, you hear it over and over again. Depression, anxiety, those are hallmarks of moral injury and PTSD. And this last link I want to show you before we get into the apps, because I love apps. We all have smartphones. Well, most of us have smartphones. Smartphones are pretty prevalent in today's society. And you know what they say, there's an app for everything, right? So universities want their students to go back to school. I want my daughter, who's not in university, to go back to school. And they will do everything they can to get people back into schools, to include have resources for dealing with moral injury through the healthcare and the university settings, through the University of California, San Francisco. And they talk about emotional well-being and coping during COVID-19. Yes, we know to wash our hands, but tips for everybody. How to stay safe from the virus, how to limit, reduce anxiety. The news, I used to watch the news all day, every day. What's the latest numbers? What's the latest infection numbers? What's the latest death rate? After a while, if it raises by 1 or 10, doesn't matter. You're just causing yourself more anxiety. So it's good to be informed, but not glued to the news, because that's just another form of inducing anxiety. We talked about eating well through the orthomolecular way of dealing with behavioral health. And ending the workday. How are we going to separate ending the workday from a home environment? Scheduling breaks. How do you divorce yourself from your computer to take a break? If your normal lunch hour, or I guess lunch 30 minutes or lunch 15 minutes that you got was eating lunch in your car, eat lunch away from your desk, away from your computer, because your brain needs a break. Yes, you're fueling your body, but you also need to give your brain a break so you can re-engage with your full work ethic. So I'm going to go ahead and I'm going to get us to some of these nice free apps. So your free training websites, free training apps. So the apps I'm going to present to you, they're going to address a lot of the issues that we have been feeling as a society, as individuals, as a profession. And for those of us who have children, I'm going to give you a parenting app that deals with some of the stress that we've been feeling. And it's not saying that, oh, how to be a better parent. I've been dealing with Susie nonstop for the past 5-6 months. They haven't been going to school, and then now all of a sudden, in addition to being a dietitian, I now have to be a 2nd or 3rd grade teacher while doing my job at the same time. That can cause stress for the most resilient of us. So we're going to talk about how to address these from a technological standpoint. So the first app I have is called the AIMS app, Anger Irritability Management Skills. So this app that I have, and it's free. All these apps that I'm showing you, they were created by the Department of Defense and the Veterans Affairs. Free, again, you've already paid for it with your tax dollars. How to better get along with people, how to control your reactions to irrational events and avoid negative consequences of getting too angry. We don't want to get too irritable, especially during these times with COVID-19 and dealing with our spouses and children. So this app will definitely assist with that. And here's what it looks like. It has different exercises, different techniques for relaxing. The first 2 that you see, deep breathing, it's, we all breathe, yay, we all breathe, but I'm still stressed. It's not just regular breathing. It's called diaphragmatic breathing. It's a clinical way, a special way. Those who do yoga, it's a certain way to breathe to elicit feelings of relaxation. The next one is muscle relaxation. And it's not just, going to get a massage or going to a masseuse. That'd be nice, but it requires you to touch you, and that's the whole COVID-19 business. We want to get touched, right? So muscle relaxation, something called PMR, progressive muscle relaxation. It is a clinical way of a self-massage. So you are progressively contracting and relaxing different muscle groups to elicit a sense of relaxation. Because we have something called the mind-body connection. So this mind-body connection basically says whatever you think and feel manifests somewhere in your body. So if you are stressed, there is a physiological manifestation of your stress. So maybe you had a particularly hard day. We're healthcare providers, so we're not doing a lot of heavy lifting per se. We're not construction workers, but you come home or you end your stressful day and, oh wow, my neck is sore, my neck is stiff, or my back is stiff. Well, I don't think you're doing, bench pressing, 600 pounds, but your back is sore, your back is stiff. That is that stress manifesting physically in your body. So that's that mind-body connection. And that app, this part of the app, especially the muscle relaxation, will help mitigate some of that physiological stress. All these tools have something in common, especially this COVID Coach app. Yes, there's an app for that. The COVID Coach app addresses, education tools, tracking your mood, and it gives you graphs because, we're healthcare professionals, we're clinicians. We love seeing data, right? So graphs, you want to see how well you're progressing over time. But again, having tools for self-care and addressing your emotional well-being is definitely paramount, and I would definitely check it out if you have a smartphone. And these are for both your Apple format and your Android format. And this is what it looks like. This is your COVID Coach app. Education, how to manage your stress, your mood once again, and how to find additional resources. All these apps are free once again. If you just go to your Google Play Store or your Apple Store, your iTunes Store, or the Apple App Store, and just type in any of these titles, they will pop up. And they're all produced by the DoD and VA, so you'll see the publisher or the maker will say Veterans Affairs or something governmental, so you know you have the right one. Getting support app. So getting support. So the ACT app. So acceptance commitment therapy. So acceptance commitment therapy, or ACT, it helps you live with unpleasant thoughts and feelings. We'll be living with COVID for a while. I don't see a vaccine happening anytime soon, and if it does, not everybody's going to get it right away. So how are you going to live with this stuff? We're not telling you to forget it. We're not telling you to just forget it about COVID. We want you to learn how to cope with it, how to earn and then get that resilience. And we want to make sure that you want to live your best life. We don't want you to be a shut-in and not engaging with people. You can engage with people, virtually and do social distancing, but we want you to continue to be happy and not feel like you have to isolate from friends and family, with the domino effect of that anxiety, depression, and insomnia. And so here's the app. So here's a screenshot of it. And this takes you through mindfulness exercises, guided imagery, guided meditation. And it's one of those things where, it tells you to close your eyes and it will verbally walk you through. So you can do it verbally or you can read about it. But I think the verbal prompts are much better, and it will give you that chance to relax and recharge prior to going to bed or starting your work day or even coming off a stressful work day. The Insomnia App. For you insomniacs out there, and I did talk about the inability to sleep, how to wind down. You're dealing with family, dealing with spouse, dealing with work, and then you look at the clock, time to go to bed, and then you lay in bed, and you can't sleep, and you can't sleep, and you toss, and you turn, and you stare at the ceiling. Not good. So your bed goes from being a place of sleep to a torture chamber. So what this Insomnia app will do, it will show you how to make your body relax, because your body has what's called it has a memory. Your body has a memory, not your brain, but your body has a memory. It knows certain places and it reacts to certain places. So if it sees your bed as a torture chamber, you're not going to get any sleep. If you lay in bed with your bright screen in your eyes, playing on your phone, your bed remembers, or your body remembers the bed as an entertainment center. So as soon as you lay down on your bed, your body's like, oh, is this going to suck, or am I really going to play? Either way, your body's not preparing to go to bed. So this Insomnia app will actually help you get to the point where your body can relax, and it will teach you how to get the most and best quality of sleep. Getting support. So you're stuck in the house with your spouse for months on end. It gets to the point to where, gosh, you're still here? I can hear you breathing. You're bothering me. That can affect relationships in a negative way. So this couples app helps couples reconnect. This couples coach helps people reconnect to mitigate some of the relationship problems that were caused by COVID-19. Because if things aren't good at home, if you can't have fun at home, if you can't concentrate at home where you now work for the majority of the time, how are you going to be productive at work? And as I said, the parenting app. Learning how to deal with your children during this stressful time. They're stuck in the house. They're not happy. We're stuck in the house. We're not happy. They act out. We act out. And it's a perpetual issue. So learning how to be positive in your comments. Have you said positive things to your child today? Yes, our children mess up, but have you said anything good today? Like, oh, that was a great drawing. And it gives you a counter to, because sometimes, having something that says, oh, I've given 5 positives and 1 negative, or maybe I've given 5 negatives and 1 positive. It gives you that self-awareness. So this parenting app could help. So in summary, got a general concept and understanding of the issues that are associated with healthcare workers with COVID-19, especially in morbidities and mortality. Gave you some resources, hopefully, that you can use to cope with some of the stress of COVID-19. And I gave you a lot of resources, the free clinical resource apps and websites, techniques for coping with some of the social issues with COVID-19. Hopefully this will help mitigate some of the issues that you've experienced or might experience in your profession. And you can take these resources to your nursing staff, to your healthcare facilities, and you'll look like a champ to your coworkers. So with that, that's all I have for my presentation. I'm going to turn it back over to Michelle Mabry.